educational series brought to you by Foot Function Labs, a leading supplier of corrector devices, and R2M Media, Patient Educational Materials Division. Your feet carry you through life. How do you feel at the end of the day? Whether you are pain-free today, simply having tired feet, or extensive foot pain, every incorrectly functioning foot step counts. A poor, structurally unsupported foot could be a silent cause of things to come. Your future foot health begins today. Please take a couple of minutes and let us explain just how important your foot function is to your overall health. Our goal for you is prevention. Who would like to prevent bunions, hammer toes, plantar fasciitis, ankle pain, knee pain, hip pain, before they become even more serious problems? Here are 14 mind-blowing statistics about foot, knee, hip problems that you may not even know about. Listen carefully. Take note of what I'm about to say, because you or someone you know has or is probably experiencing some of these already. The average adult takes 4,000 to 6,000 steps a day. The average person walks about 100,000 miles in a lifetime. The average woman walks 3 times more per day than the average male. 9 out of 10 women wear shoes that are too small for their feet. 75% of Americans will experience foot problems at one or more time in their lives. 80 million Americans, or 25% of the U.S. population, have flat feet. Over 2 million Americans seek treatment for plantar fasciitis, heel pain, each year. Approximately 1 of every 12 adults over the age of 25 in the U.S. will have knee replacement procedures within their life. The annual number of hip replacements among adults 45 and over more than doubled between 2000 and 2010. Most common total joint replacement procedures in the U.S. are total knee replacements, 700,000 a year. Hip replacements are 400,000 a year. More than 4.5 million Americans are currently living with at least one total knee replacement. 63% of total knee replacements are women. By 2030, it is estimated that over 67 million Americans are going to suffer from some osteoarthritis. Over 50% of adults diagnosed with knee osteoarthritis will undergo a total knee replacement. We believe prevention is the key element. Get a preventative screening long before a problem arises is the answer. Just having tired, sore feet at the end of the day is an early warning sign. Don't ignore this warning until it becomes a much bigger problem. In this diagram, you can see a normal arch on the left, over-pronation or fallen arch in the middle, and an under-pronated arch on the right. Viewing your ankles from the rear, notice the bowed Achilles tendons are on the left. This is ankle pronation, or fallen arches on both feet on the left side. Can you imagine why you would have tired feet at the end of the day with fallen arches? Tired feet with fallen arches over time becomes a structural, functional problem. As the arch falls inward, the tibia leg bone rotates inward as well. The knee then bows inward, putting increased pressure and abnormal wear on the knee cartilage. Next, the hip bone abnormally rotates in the hip socket, resulting in excessive wear on the cartilage in the hip socket. Over time, pelvic unleveling can occur, causing problems in the sacroiliac joints and the lumbar spine. In everyday life, this is what you would see if someone had fallen arches. You might experience tired feet or more. The knee would tilt inward. Walk with a dipping or rocking motion. This is what this silent structural problem looks like in everyday life. Are you beginning to see how a simple foot condition, like a fallen arch, even if not symptomatic today, could be a silent cause of multiple problems? The body is designed to function in a balanced, harmonious system. Let's look at the potential results of a simple, uncorrected problem like fallen arches, even if you are not currently experiencing pain or discomfort. Remember the statistics. 60 million Americans, or 25%, 1 in 4 Americans, will have flat feet. One of the most common myths is that bunions are a result of wearing high heels or pointed toe shoes. How did women who never wore heels or pointed shoes, or men for that matter, get bunions? There are over 40 different types of bunion surgery done in the United States. According to our research, we found that the median price tag hovers around $5,560, but it can range between $3,500 to over $12,000. Are you willing to ignore a simple correction and wait till you need surgery later on? Another problem that only quote-unquote older people have is hammer toes. Why is it only a senior problem? Did hammer toes magically appear overnight? I don't think so. Do you? Plantar fasciitis, pain on the bottom of the foot, can be constant or only when walking or running. Who do you know that is complaining of this kind of pain? Over 2 million Americans seek treatment for plantar fasciitis and heel pain every year. Then there is ankle pain and various kinds, especially with movement or exercise. Next, we have knee pain. Recall the structural problems of what happens as the arch falls and the tibia rotates inward. Approximately 1 out of every 12 adults over 25 in the U.S. will have knee replacement procedures within their lifetime. Did you ever wonder why one knee wore out before the other one when you used both knees every day? Total knee replacements are about $700,000 per year in the U.S. The average cost for a total knee replacement in the United States is $57,000. Assuming typical coverage, your out-of-pocket cost could be $4,400, and that's in 2017 costs. Again, recall the structural problem. After the knee rotates and falls inward, the hip bone rotates in the hip socket, causing abnormal excessive wear on the cartilage. There are around 400,000 hip replacements per year in the U.S. Let's review this silent start to a long-term structural imbalance problem again. The foot flattens with a fallen arch, stretching soft tissues in the foot and ankle. The tibia rotates inward. Knee moves inward, putting abnormal stress on ligaments and cartilage. The femur or leg bone rotates inward in the hip socket, putting abnormal stresses on the ligaments and the cartilage. The pelvis tilts forward, shifting weight, causing excessive strain over time on the sacroiliac joints. Eventually, the abnormal stresses and weight shifts and transfers up into the lumbar spine and discs. If uncorrected, this long-term abnormal structural distortion adversely affects connective tissue, ligaments, cartilages, and bones, which results in multiple common conditions such as bunions, hammer toes, ankle pain, knee pain, hip pain, back pain, to name a few. Let's view a real-life person in good health who exercises regularly. His knee pain is hindering his workouts and running activities. Look closely at his feet, knees, and hips. Here we have a 40-year-old patient, male, in good physical shape, and yet he still has foot pain. As he walks closer to the camera, you can see that his arches are fallen. Look in the yellow box on both sides. This throws the forefoot off and the back. As he rotates his ankle up, this is more of a normal position. See how the toes have raised off the floor. There's an angle under the arch and an angle to the heel. Notice that his toes are trying to grip the floor because the arch and the forefoot are not in the proper position. This can lead to a condition of hammer toes, as you can see in the diagram. Also, look on the other foot as the arch comes up. Notice the three angles that have to be balanced. You can also see how the big toe is starting to deviate, so there's the beginnings of a bunion. Notice the Achilles tendon lines. They're supposed to be straight. They aren't. They're at an angle. That's because, of course, the arch has fallen. The dotted line shows you a more normal position. Again, see how the angle of the heel, arch, and the forefoot all have to be in the right angle and the right balance. Again, as we look at his right foot, see the angle of the heel, the arch, and the forefoot. Watch his leg move. You can see how it's going to affect his knees as well. When the arch falls, the foot overpronates, the knee internally rotates, the knee moves inward, and it can move all the way up to the hip. As you can see in our subject here. The knees are fallen inward because the ankle is rotated inward. Notice the movement of the knee, and it's going to transverse all the way up to the hip. This is going to cause extra wear and tear to the inside of the knee and extra wear and tear to the hip. This is why having our foot, arch, forefoot, heel, and arch angles all properly aligned is so critical to the knee, hip.
Did you observe the silent structural problem at work behind his complaints? Ask your doctor to schedule your complimentary gait and foot screening evaluation today. Prevent future foot, knee, and hip problems. Stop any current conditions from progressing. Eliminate or alleviate any painful conditions you already have. Who else do you know that could benefit from this screening also? What is this silent structural problem costing you today in terms of missed or limited, lost in family activities, social situations, and daily life? No matter what your daily footwear is or what you participate in, we have a solution for your silent structural problem correction. Are you at risk? Find out. Speak with your doctor about getting your foot screening evaluation today. We can help you no matter what your footwear or activities are. This has been an educational series presentation brought to you by Foot Function Labs, a leading supplier of corrective devices, and R2M Media Patient Educational Materials Division. Thank you.